Good afternoon, everyone, and welcome to our August 6th Town Hall meeting. We apologize for having to push it off for a day, but glad that you could join us. We have a variety of presenters here today, and we've got a few overview comments that we're going to share before we take your questions. As a reminder, if you have questions for us, please use the Q&A panel down at the bottom right-hand side of your screen. If you see a question you like, please feel free to press the like button so that we know that it's an important question. As always, we'll try to answer all the questions. If for some reason we can't get to them all, we will get them to the appropriate person, get them answered, and post them on the website. So with that, we're going to start with Dr. Homan. Dr. Homan?
Thank you, Dr. Rhodes. I want to welcome everyone to the Town Hall meeting. I see we have almost 140 attendees, so I think this continues to be a good vehicle for us to be able to have a mutual conversation and answer lots of questions during this very challenging time. I just had a few comments to make before we have the other leaders also make some comments before we open up for questions. One is that we started the orientation for our MD students and for the MedMaster students. And I want to thank Dr. Flenner, Dr. Knight, Joanne Boddy, Dr. Combs, Diane Daughtery, who helped to create, I think, a very robust virtual orientation process. It's been difficult, as you can imagine, because it's always nice to see all the students' faces and be able to connect with them on a personal level. So it really is challenging. And yet I think it was done very well, and we're going to continue that process. So everyone's been lined up, I think, in terms of the expectations for the educational program. I'm sure there'll be many more questions from the students over time. But the team has done a great job in terms of the communication process, so I want to thank them. And I want to welcome all the MD class as well as the MedMasters class. We just are thrilled you're all here. If anyone's on the line, welcome to your first town hall. The second item, and I know Dr. Flenner may speak to this, accreditation. A lot of effort went into this with his team, he himself personally. Dr. Malona participated, Dr. Combs, Dr. Brooke Hooper, Millie Kennicott, a whole series of individuals. That was submitted, the data collection instrument was submitted about 2 weeks ago, and now we have just a couple more weeks to be able to provide more data. I'm really happy that the graduation questionnaire came back with a high participation rate among the students. And the results, I thought, were very reassuring and very good. The students, I think, are extraordinarily satisfied with the educational program. I told the students yesterday that's not good enough. We're going to continue to improve on this with their input and provide opportunities to be able to continue to refine the Care Forward curriculum that was rolled out in 2016 with the last graduating class having completed the entire curricular components. So I want to congratulate again Dr. Flenner and his team for those results. Those results from the GQ are going to be going to the LCME, so they have that as the updated database for their on-site visit in October. We also have a mock survey with our consultants in late August, and I'll have Dr. Flenner review that as well. So a lot going on from the accreditation standpoint with LCMA. The SACS accreditation continues as well in parallel, and the quality enhancement plan that we've identified as cultural humility, and there'll be a communication strategy to provide more information to the students, staff, faculty, in terms of the priorities and the curricular component, which will be rolled out in the School of Medicine and eventually rolled out in the Health Professional School as well in the coming years. So we're doing this in parallel, a lot of work, a lot of communication, but I think really want to thank Dr. Combs and Dr. Flenner for the outstanding work that they've done to be able to manage that. A third issue is, you may have seen in the paper or an announcement, there was a consultancy that's been engaged from the recommendation of the governor. Our Board of Visitors has approved it to be able to have leadership from Centera, Evms, and ODU get together with a third-party consultant called Manat Consulting from New York, and they're going to assess the opportunities that we have available in Hampton Roads to be able to work together more efficiently and effectively for our mutual benefit, also to provide sustainability for EVMS's long-term financial health, and provide opportunities to improve the health disparities in the region. So I think that's an exciting opportunity in the future. More to come. There'll be some interviews that'll occur among our leadership within the faculty and leadership group And eventually the recommendations are to come out by November 15th in preparation for the next General Assembly and legislative session. So there'll be a bit of work going there as well in parallel with the LCME and STACS accreditation. But there'll be more information forthcoming in the coming weeks as this rolls through. The last, I just want to make it clear that, again, this is an extraordinary time, and I want to thank Dr. Combs and his team for the ramp up, Dr. Wasilenko for the ramp up on the research piece, that everyone has to continue to use masks, social distancing. We have to have abilities to keep us all healthy, provide opportunities for us to be able to keep our clinicians healthy, our students healthy, faculty and staff, as well as to ensure that our community and the patients we serve have a minimized risk. And Dr. Stouter and Dr. Baumgarten have done an outstanding job on the clinical side to mitigate that. But it's a lot of work, and it takes commitment. And there's a strong commitment that everybody has to have to continue to do masking on campus all the time. Unless you're in your office and you're alone, you should be with a mask. And even when you're alone, if you've had people in the room, you should be aware that the virus still aerosolizes sometimes. You still may be at risk. But not only at work, ensure that everybody takes care of themselves in their personal life as well, because that's where a lot of actually there have been more exposures among our faculty and staff from the community rather than from their work environment. And so don't let your guard down. It's really important to be able to stay safe with masking, distancing, hand washing, sanitation, etc. When you're on campus, make sure that happens off campus as well. So I'll stop there and have Dr. Rhodes go ahead and introduce our next speakers before we have the Q&A session.
Thank you, Dr. Homan. Dr. Combs, if you'd like to give an overview.
Yes, thank you, Vincent. Just a couple of things very quickly. We have been working hard to try to make it clear where employees and students can go to get information. And I just want to reiterate to everyone watching, if you've got questions about what you should do if you may have been exposed to COVID, if you go to the EVMS COVID, if you literally just type in your browser, EVMS and COVID, it'll take you to a page that has a little graphic on it that looks like the virus. And on that page are 3 buttons, if you will, and one of them is, what should I do? And if you click on that, there are 2 paths. One is for faculty, staff, residents, and fellows, and the other is for students. And the primary difference is that the employees are directed toward occupational health and students to student health. But we tried to lay everything out in a very stepwise way so that if you have any questions, we think that will answer it. As Dr. Holman indicated, there is now a community spread of the virus that's fairly widespread. Norfolk is a hotter spot, if not a hot spot at the moment. That will shift. We continue to learn about the virus. We continue to learn that the strategies that we've implemented here of always wearing a face mask and doing everything possible to maintain social distance and regular hand washing are in fact proven successful strategies. So I would reemphasize the point Dr. Holman made. You need to do that, but it's not enough just to do it when you're in an EVMS building. You need to do it wherever you are, because most of the exposures that have happened have not happened at work. As we reconstruct the transmission, they've come from community outings, and we can talk more about that later. We're getting our first batch of entering students. As Dr. Holman mentioned, yesterday we had about 250 new students come on, and we'll have another 300 or so come on the end of August. So it's exciting. It's also a little scary, frankly, because this virus is proving to be persistent and to some extent unpredictable. To that end, we're going to do as much education as we can do remotely, but at the same time, we realize that there are some essential components of education, learning skills, having group interaction, having lab exposure that you really just have to do on site. So we've developed pretty rigorous protocols as to how that can be done to ensure the safety of our learners and our teachers, and would ask everyone to, for the balance of this year, really make it a point to be patient and to be persistent. We're going to try as hard as we can to make the educational experience as outstanding as it always is, but it will be different this year, and we will require everyone's help and understanding. And I think, Vincent, that's all I got to say for right now.
Thank you very much. Dr. Flenner?
Thank you, Dr. Rose. Good afternoon, everyone. Just a few things already has been mentioned that we are welcoming new students on campus this week, and have to thank Dr. Kendercat and her team for the wonderful welcome that she has provided with a detailed orientation, as well as Dr. Wellman and all of the module directors for the M1 students. Dr. Hooper has been working incredibly hard to ramp up our clinical education and re-engage students in the clinical arena. The fourth year is engaging in electives, and the third year is soon to begin their clinical clerkships, which has required an inordinate amount of time, energy, effort, and coordination. So thanks to those individuals. As Dr. Homan also mentioned, our accreditation process is ongoing. We submitted the DCI, or Data Collection Instrument, which is a required component of the accreditation materials earlier, actually in July. And have to thank Julie Stoner and Molly O'Keefe, who put in an innumerable number of hours to make that possible. And we have our mock site visit the end of this month, August 31st, and we've been working on the logistics of that. And the actual visit will be in October 4th through the 7th. That is currently scheduled, and that will be a virtual visit. In addition to that, we also are rolling out our QEP, or Quality Enhancement Plan, which is part of the SACS accreditation, and have to thank Lauren Mazurko and Don Robinson for all the work they did for the curricular component of that project, which is currently set to roll out this week with surveys. And I'd like to say that we're ahead of the curve in the topic that we chose, Live Humble, to address racial inequality, health disparities. So even before all the problems that we're experiencing in society today, we recognize that as important topics, and we'll be rolling those out into the curriculum. And that's all I have to say, but we'll answer questions later in the session.
Thanks so much, Dr. Flenner. Next, Dr. Baumgarten.
Thank you, Vincent. I'll be brief and quickly update on a few things that have been happening on the medical group and quality side. I will start with PPE and wanted to assure you that we have adequate PPE supply. We're monitoring it very closely, and we have enough of everything what we need to provide safe care, including N95. We are monitoring it on a weekly basis. We're distributing to practices, and we are slowly and steadily building our stockpile, that we have enough supplies for the fall, where we are going to be expecting second wave. We have established protocol for disinfecting N95 on campus. We will be starting pilot disinfecting next week or within next 2 weeks, so more information to come, but we want to have it ready that it could be quickly ramped up to our needs later on or early in the fall. In terms of our clinical protocols, July been a productive month for us because CDC updated several recommendations, so we have updated those. Information about treatment became available. Dr. Merrick updated clinical protocols, so all those were updated in the end of July and posted to our website, and supplemental documents like self-monitoring forms, etc. are available to you on COVID-19 My Portal site. And if you have any questions, any concerns, need help to interpret those, please feel free to contact Allison and I. In terms of drive-through testing, we open our drive-through testing center on March 16th. We now have the shed that you can see behind me. I'm wearing a mask because I'm not by myself here, so Allison is here wearing a mask as well. But since we established drive-through clinic, we've been testing employees, very few patients. We've tested over 250 over 250 people, over 240 employees over 16 weeks. And we had 14 positive employees at Evms, 1 faculty, 9 residents, and 4 staff members. And you already heard Dr. Combs and Dr. Homan mentioning increased number of cases in our local community where we are a hotspot now, and it correlates well with our drive-through clinic. In July, we saw increased number of COVID cases in the local community, peaking at 140th in July, between July 6th and July 30th. And that when we see peak of our positive cases in our drive-through clinic. However, it seems to be number stabilizing, and I hope that governor's restrictions and recommendations will help all of us. And I wanted to thank everyone for embracing our universal masking policy and wanted to encourage you to take it outside and use it in the community. A couple of other comments because it's important for you to know, and we got some questions how sick our employees were when they tested positive. Out of 14 who tested positive in our clinic, everybody had mild disease with a couple having moderate disease. There were also 15 positive cases reported to us where testing was done elsewhere. And out of those 15 cases, 2 required hospitalization. So overall at EVMS, we had 29 positive employees, 2 required hospitalizations. We prepared all this data for you, so it will be posted on their EVMS COVID website as a dashboard that will be updating weekly. And it will provide you with that exact information, how many people we tested, how many positive, how many were hospitalized, to give you a real time look into what's happening at EVMS community. And as a medical group, we've been working also on our ACO metrics. As you know, medical group entered Centera ACO SECA with other partners on January 1st. So in July and prior to, we've been working on several measures, but really trying to ramp it up and working currently on several quality initiatives that we believe will help us to be successful in ACO. And we are building plans for how we will do in the fall to keep everyone safe and provide patient care. So those are topics of discussions, including specific plans from the department and our patient safety quality committee in September, and we'll continue to update you regularly. But again, if you have any questions, don't hesitate to reach out and we'll be happy to answer any of your questions. Thank you.
Thank you, Dr. Baumgarten. Dr. Stouter? Dr. Stouter, you're muted.
Thank you, Vincent. Appreciate it. Good afternoon, everybody. I want to just piggyback and emphasize a couple of things that have already been stated, but also I want to really thank everybody in the medical group and everyone involved in making sure that our patients, our employees, and their families are safe. To date, we've still had a 0 transmission that has occurred originating in the ambulatory clinics. I think that should be celebrated. It also is a high bar because as the COVID starts spreading more in our area, we have to work even more diligently to make sure that we maintain that 0 defect target that we've been able to achieve. With that, we have been able to stand up telehealth, and we've also in many areas been able to stand up remote working processes. I see there's a lot of questions, and I'm sure from an HR standpoint, we'll address a lot of these, but I just want to emphasize that we really are working with the supervisors and determining how we do telehealth and or remote working. It really is a function of, do we have the technology to be able to work remotely, and do we have the proper oversight and ability processes to support that? It really is up to the supervisors, and with the medical group, we're emphasizing we'd like to do that wherever possible, but it really is the supervisor has to run that unit and make sure that we're able to accomplish what we need to. The other thing is with the inclement weather, we had another test opportunity where we were shut down for half a day, so quickly we were able to flip many of the practices into telehealth and maintain that patient contact. And in some of the areas, we have more tested remote working processes, and we're able to have people be productive at home during that half day. So we are getting better and better, and I'm sure we'll address more questions as they come up. I also want to emphasize universal masking. That's what's going to save us, whether you're on campus or in your personal life. Distancing, masking, I just want to emphasize that, and that is really what is helping us be successful. Also, for the new students, I encourage you to get familiar with the Student Health Clinic. We have a new physician starting, and we're there available, answering phones, scheduling appointments. So if you've not had the opportunity to know where that's at, I encourage you to find that, and we look forward to supporting you going forward. Thank you.
Thank you, Dr. Stauder. Next, we'll have the Executive Director for Human Resources, Matthew Shang. Mr. Shang.
Thank you, Dr. Rhodes. Just wanted to, Kurt just touched on this, but I wanted to first start out by saying we recognize in human resources and as an institution that there's a lot of concern. There's going to be a lot of concern regarding childcare due to the fact that public schools have now made the decision to at least start out the school year in a virtual learning environment. As we speak, my office is researching and identifying possible options and tools that we can give to supervisors to try to assist employees with this issue. And it's one of our top priorities. It's important, though, to understand as we go through this process that we have a lot of different jobs here at EVMS that perform a variety of job duties. And there's not going to be a one-size-fits-all solution to this issue. It's a complex issue. With that being said, part of the process, wherever we land, part of the process is going to be evaluating requests for individuals that are dealing with this issue on a case-by-case basis. As Dr. Stauder said, part of that process will require supervisor approval. So as a first step, as we move into, closer to school time starting, you need to be having conversations with your supervisor if you have an issue to see what, if anything, we can do in terms of coming up with an arrangement. But whatever arrangements we come up with for employees, everyone needs to keep in mind that they have to be not only beneficial to the employee, but they have to allow the departments and their units to meet their operational needs. In other words, we have to continue to operate. So we're going to do everything we can to assist our employees. But certainly, like I said, there may be certain positions that that do not lend themselves well to remote work, for instance. We'll see if there are any other arrangements we can come up with. But remote work in and of itself is not going to be that one size fits all solution, as I said earlier. So again, it's a high priority for us. It's something we're giving a lot of attention to, and we will continue to give a lot of attention to. So I do want to reassure all our employees that it is something that we're focusing on tremendously right now, and we know that it's going to be a pain point for some of our staff and faculty. So having said that, like I said, to reiterate, whatever we come up with, and we'll be issuing more guidance to supervisors in the next couple of weeks, if not sooner. The process will always start with the conversation with your supervisor. If you have a concern about the decision that was made or how or the conversation in general, you certainly are, as with anything, can talk to HR. We're here to listen and try to assist if we can in any way that we can. The last thing I wanted to say was just, it's already been said a couple times, but I don't think we can emphasize it enough. Please adhere to the universal masking policy. That's very important. We have guidance on how we would enforce that, but we really don't want to go down that path. We'd like everybody to do it because it's the right thing to do, and it keeps the campus safe.
Thank you, Mr. Shang. So with that, I think that concludes all of our overviews. Just so folks watching the town hall know, Dr. Wasilenko, who is our Vice Dean of Research, Mr. McBib-Gameta, who is our Vice President for Diversity and Inclusion, and Ms. Helen Hazalius, who is our Senior Associate Vice President for Business and Finance, are also on the town hall and will be able to answer questions for you. Before we start, I do want to give everyone a reminder. Although we aren't able to be together for in-person celebrations, we do have our Faculty and Staff Awards coming up in the fall. We are seeking nominations for outstanding faculty and staff And certainly during this challenging time of COVID-19, we have folks that are doing amazing work. Nominations are due by August 28th for faculty and staff awards, and you can nominate people at evms.edu/awards. So after the town hall meeting, please do take a look. Please be thinking about folks that are doing an outstanding job, and do nominate your colleagues. And with that, we will turn to our questions. We have quite a few to start. The first is a housekeeping question. A guest asks, when did the policy change where high-touch surfaces in buildings are being cleaned every 2 hours? It's definitely not happening in Lester Hall. Ms. Cecilius, perhaps you could address that. I don't believe the policy has changed, but I'll turn that over to you.
Sure, thank you. The policy has not changed. The policy has always been that we would be cleaning twice a day. And so if you noticed or not witnessed somebody cleaning at least twice a day, then I would ask that you get in touch with Mark Wilson. Also wanted to provide some guidance on what our cleaning protocols are. They are posted on our COVID website on the web pages. If you go to the EVMS ramp up section and under additional resources, there is a link for housekeeping protocols. And I think it's useful information and provides a lot of detail on what we're doing to make sure that our facilities are cleaned.
Thank you so much. Dr. Homan, this question is for you. Sharon asks, is the consulting firm being hired doing a feasibility study about a potential merger between ODU, EVMS, and Centera? How could this benefit the community? Dr. Homan?
Sure. Well, the consultancies to assess different opportunities and options, to look to see how we can work more effectively across institutions in the context more of an academic health center model that I'm trying to aspire to since my arrival here 8 years ago. This provides an opportunity for us to work more collaboratively with Centera, which is a first-class medical healthcare system, and to work with ODU in terms of their research and academic programs. There's no preconceived notion as to what's going to happen. They'll be conducting interviews from the leadership at Centera, leadership at ODU, and leadership at EVMS. And after hearing that, they will come out with some recommendations for how we can be more effective in this region. My hope is that one of the objectives we can look at is and address is to improve the health disparities in this region. The health disparities are pretty stark in the Hampton Roads area, and there's a lot of work we can do that can benefit all of us. It could create opportunities just to improve the health of disadvantaged communities, which is a principal reason. The second would be to identify ways to be able to create academic and scholarly work around that, to be able to demonstrate through publications and best practices and clinical guidelines to other like institutions around the country, how they can work with their communities to improve the health, working together with our hospital system, local university, and the medical school, and as well as to try to improve the healthcare and reduce the healthcare cost, increase value and reduce cost of the delivery system. So I think there's a balance in all of these different entities, institutions, and we're going to find ways hopefully to get a win-win-win across all of them so we can work together more effectively as a team, meet our core missions, and then, as I mentioned, help to improve the health of this region and especially those that need it the most.
Thank you, Dr. Homan. We have a follow-up question. Anonymous asks, who's paying the fee for the consulting firm?
The fee is going to be split, although Centera, it's a $285,000 fee. Centera is going to pay $1,000 of that. EVMS is going to be paying $25,000, ODU $25,000, Reinvent Hampton Roads, I believe, is putting in $25,000, and the state, I think, is going to contribute as well. So we have a small amount of funds that are being invested in this, but we're very much invested in the ability for us to be able to be included for the dialogue and to try to help to shape the recommendations.
Thank you, Dr. Homan. For Dr. Baumgarten or Dr. Combs, a staff member asks, can you please explain what constitutes an appropriate cloth face mask? How should it fit and what kind of maintenance should be given to it? Dr. Baumgarten, perhaps we can start with you.
Great. I can answer this question. So when we are referring to fabric mask, that this is fabric mask that someone a face covering could make, there are no specific requirements or recommendations. But in our PPE policy, we have recommendations for what it means, what are appropriate settings where a face covering or mask could be used, and how it could be maintained or taken care of. So at Evms, all masks that we're using, we are recommending daily use, so use it for a day. And we recommend that face coverings or face masks, fabric cloth ones, will be washed. Cupron is it also fabric mask, but it's made out of different material, which is impregnated with copper, and it doesn't wear off. And that also recommends for daily use, and that's what we've been distributing at EVMS. And again, if you look at our PPE protocol and universal masking policy, it has a recommendation for each kind of mask we have at EVMS, what it's recommended for, and how to take care of it.
Thank you so much, Dr. Baumgarten. This, I think, will start with Matthew Shang and then perhaps Dr. Homan. And I realize that you covered this already, Matthew, but I know it's an important issue, so it probably bears repeating. An employee asks, now that the local municipalities have stated that K-12 public schools will be virtual for the fall term, how is senior leadership addressing this issue for employees that have children whom this impacts?
Thank you, Vince. As I said at the beginning, what we're doing right now is we're gathering information, researching different options. We're looking at what other employers are doing, so we're not reinventing the wheel, and also seeing what makes sense in our work environment, and what makes sense relative to our operations. So right now we're just gathering information to come up with options and tools that we can then disseminate out to the supervisors, and that will help them deal with these requests as they start to come in. But I think it's fine to, at this point, to start having conversations with your supervisor if that is going to be an issue for you, to give them time to think about what, if anything, they feel like they can do or offer. It all has to run through the supervisor. So that's the first step. I want to emphasize that. So if you're in that situation, I would encourage you to start having a conversation with your supervisor. Again, the more time we have to look at the issue, to consider the issue, the better off everyone's going to be.
Thank you very much. Dr. Homan, did you have anything you wanted to add?
I think Matthew summarized it well. It's up to the supervisors to determine. We've done a lot over the last 3 months to be as flexible as we can for the work at home policy. And so we wanted to try to look to see how we can be as innovative as possible. Notwithstanding, there are some positions, as you can understand, that have to be done on site and to maintain our operations. So it's striking that balance that we need in terms of the employees' welfare and ability for us to be able to deliver that which we need as an educational, research, and clinical enterprise. So we're going to try to do as much as we can. Matthew's going to be looking at all the different models around the country, regionally. We try to be as flexible as we can. And I'll just say we're going to do the best we can do. We may not be able to satisfy everyone, but we're going to try to be as innovative as we can to be able to meet the needs of our employees and the institution.
Thank you, Dr. Homan, much appreciated. Dr. Combs, I think this question is for you. Regarding the ramp up, Anonymous asks, why are we still ramping up and bringing employees back to campus when the numbers are climbing, especially for those employees who can work from home?
Well, I think Dr. Holman addressed that really. It's a question of balance, and we're promoting as much remote work for as long as possible to help get through this very difficult situation. But there are some jobs, there are some aspects of all jobs that are better done face to face, and so we're trying to find a balance that allows us to get the work done that needs to keep the institution moving, yet providing as much flexibility as possible. Although we have ramped up in the sense that we've run people through training programs and they are qualified to come back to campus. Not everybody is here, and not everybody is here every day. But I think that going forward, there will continue to be a dialogue and a need to balance, trying to do everything we can to maintain the safety of individuals, but at the same time, getting the work of the institution done. Vincent, you're muted.
Can you hear me? Great. Sorry. So a follow-up question for that. Again, staff member asks, since Norfolk's a hotspot, will the institution allow non-essential workers who've been adequately working remotely since the start of the pandemic to remain remote? You just gave an answer. Just going to summarize what I think I heard, which is working with supervisors, we're encouraging people to continue working from home as they can, unless it's a situation where we absolutely need a body here on campus. Anything else you want to add to that, or are we good? Okay.
That's correct.
All right. A staff member asks, and I am not sure, this might be either for Helen Hazalius or Dr. Baumgarten, when will EVMS be offering the flu shot for employees?
I can answer that. We are expecting to get the vaccines at the end of September, so we'll be rolling that out at the beginning of October.
And a follow-up question for that, Helen. So how is that going to be managed with quite a few employees working remotely?
We are just in the planning phases of how we're going to roll this out. We have to consider that. We also have to consider the distancing issues. So there'll be news to come, and there are things that we are considering as we look at providing the flu vaccine.
And this is Margaret. I will add, thank you, Helen, that we are also exploring option of providing flu shot through our drive-through clinic, so more to come. But we're exploring different options of how it could be delivered effectively and efficiently in a setting maybe we haven't delivered, flu shots to our employees or patients before. But new times, we're looking for new opportunities and developing new strategies. So that's one of the options that we may have.
Thank you both very much. A student asks, and I think this would be for either Dr. Combs or Dr. Flenner, I appreciate my program doing skills in small groups to limit exposure, but it seems to defeat the purpose to have other activities with our whole entire class of 80 plus people, for example, exams and exam reviews. Who's the best person to reach out to about my concerns on this EVMS decision?
Well, it sounds like a PA question, but I think it applies also to medicine and any of our clinical programs. So let me try to summarize where we are educationally. Number one, we are going to do everything we can do to make sure that didactic/lecture materials are handled remotely. But for those programs that have a clinical enterprise, the nature of the enterprise is they're interacting with people, and there's always some risk in that regard. Also, it's important to understand, for example, the question about reviewing. We're going to put dividers in Lester Hall, in McCombs and Roper, as well as some other places, and the review sessions will have socially distant settings, as well as we continue to require masks, so that we do envision bringing students onto campus to do simulations in the clinical skills simulation in the SIM Center, some small group discussions, and some review sessions that are appropriately social distance. There isn't a perfect answer for the situation that we're in. We're trying to balance things as much as we can, and when we do bring people onto campus to do skills or small groups or review sessions, we're following standards set by the CDC to ensure safety as much as possible. Dr. Flenner, you want to add a little bit to that from your perspective?
Dr. Combs, I think you summed everything up in the discussions that we have with the ramp-up meetings held regularly. Again, delivering as much of the curriculum remotely and virtually as is possible, but for those activities that require in-person attendance, we are ensuring the safety of the learners with appropriate social distancing and cleaning and PPE as indicated.
Thank you, Dr. Flanner, and thank you, Dr. Combs. An employee asks, and before I direct this, I'll give some background. An employee asks, will EVMS be encouraging staff to participate in the new COVID-Wise app through the Virginia Department of Health? For those that may not have watched the governor's press conference yesterday, the Commonwealth of Virginia announced an app they call COVID-Wise. It's available via iPhone or the Android store. Basically, it uses Bluetooth. It is anonymous. It does not report where you have been or who you've come in contact with, but it just, based on your proximity to that person and the Bluetooth strength, uses an anonymous token. If that person later reports that they are COVID positive, it will notify you if you have been close enough to that person for long enough duration of time that you might want to get tested as well. So that's the COVID-Wise app. Dr. Combs, Dr. Baumgarten, Dr. Homan, perhaps one of you would like to address this?
I think Dr. Baumgarten ought to respond to that, but Margaret, I think it would also be helpful if you would start out clearly defining close contact exposure to help people understand the continuum of exposure risk.
Sure. I will just start and then I will get to answer this particular question. So when we're talking about contact and exposure, we refer to an interaction between two people. One of those is COVID positive that lasts for longer than 15 minutes and within 6 feet distance and no proper masking or personal protective equipment. And distance could be shorter if somebody is actively coughing and sneezing, and you might be exposed to secretion. So we have a lot of information about contact and definition of contact on COVID-19 website. And we incorporate that workflow into our protocols that we developed in the REDCap survey that is under that what should I do button that Dr. Combs mentioned, where we're encouraging employees who believe they had an exposure to answer that survey, and answering this REDCap survey triggers alerts that will inform you in real time either you had low risk exposure or you had potentially high risk exposure that you could be or would need to be further evaluated, and depending on your symptoms or no symptoms, whatever recommendations and screening is now conducted by occupational health, further actions are decided. So we already have this in place, which in large very similar to the goal this app is trying to achieve. Information about all new, so we have not made any formal decision at EVMS. We do meet regularly and we discuss similar and such topics. So we will have a further discussion with our ramp-up committee that involves a lot of people who you see on today's panel discussion, and also Dr. Oldfeld. Then we can see and make specific recommendations for what this app is, should we not, how it will work with other things we already have in place at EVMS, which I mentioned, REDCap surveys, screenings conducted by occupational health and student health, how they're all going to be talking to each other. So once we review it and make decision, we definitely will post it and we'll make sure everybody is informed and we have uniform policy or recommendation.
Thank you very much. As most of you can understand, this was just announced by the governor's office yesterday, so I'm not sure we have an official position on encouraging it, but it's worth taking a look at the app. I certainly downloaded it. Certainly would help you understand perhaps if you were at risk from community spread. So take a look, see if it's for you, and whether it's an app that would be appropriate for you. So thanks, Dr. Baumgarten and Dr. Combs. Our next question was for Dr. Combs. I believe you've answered this one already, Dr. Combs. Can you confirm that HP programs are to be online? At this time, some of them are still saying there will be in-person classes. What I heard you say was everything that we can possibly do online, we're going to do online. If we have to bring people together for clinicals or labs or those kinds of things, we will do our best to social distance and use PPE. Was there anything you'd like to add to that?
No, just again, that's an example of where we need people to be patient and persistent. We have to balance the educational needs of the program. And if you're in a clinical discipline, there's no way that you don't involve contact with patients and other clinicians. So our objective is to follow the guidelines and ensure safety as much as we can. It is to encourage everyone to do as much remote education as makes sense. And it is to bring people on campus for those aspects of education that in the professional judgment of the faculty need to be done face to face. And when that is necessary, to do it in the way that is determined to be safest for the participants.
Thank you, sir. This next question pertains to Waitzer Hall and is for Helen Hazelius. An employee asks, when will the podium be open for students? Is there a time estimate for the tower section?
Yes, thank you. The podium is expected to open at the beginning of September. We are a little bit behind schedule due to COVID, and the storm this week did not help. So the expectation is to have it available and open for students at the beginning of September. The tower is also delayed. We are expecting to have it completed end of October, beginning of November, with departments moving in November and December. So the plan for departments will be to move in various departments by floor, and we will be reaching out as we get closer to the various departments to schedule the moves and be working with them to coordinate that.
Thank you very much. This is a medical question for Dr. Baumgarten. A staff member asks, are the symptoms mild for most of the recent COVID patients only because it's summertime, and are the symptoms more deadly during colder months?
Well, great question. I don't think that months of the year play a role, but I do have to admit that most of their employees or positive residents faculty we had at Evms are younger people without any significant number of chronic medical problems that typically put you at risk. So high risk, age, and certain medical problems. So statistically, if you look at the data, that about 80% of people have mild to moderate disease, and then 20% have more severe disease, and 5% of the patients with COVID require ICU admissions. In our EVMS community, and again, I think that overall we don't have most vulnerable, we don't have people over age of 80, we don't have people with multiple comorbidities, that our statistics is a bit different. As I mentioned, out of 29 people positive in EVMS community, only 2 required hospitalization, which is much less than 20%, and we didn't have any ICU admissions or critical care. So I don't think that timing of the year plays a role, but age and comorbidities definitely do.
Thank you, Dr. Baumgarten. An anonymous participant makes an observation. Masks are not being worn correctly by many EVMS groups, mentioned security, housekeeping, staff, and students. Question that they pose: when we see the mask mandate not being followed, how should this be reported? Who will handle immediate enforcement of the mask mandate? Dr. Combs?
Yeah, I think actually I'd like to punt that one to Matthew because it is a personnel issue and we do have processes in place, and I think he's probably the best suited to give a clear answer.
Sure. There are basically 2 avenues which you could report that behavior. You could report it directly to Human Resources when we would investigate, and depending on the outcome of the investigation, we would take appropriate action. Or if you prefer to do it anonymously or through a different avenue, you could report it on the compliance hotline, the EVMS compliance hotline. It will be then referred back to my office to investigate. So that's a less direct route. But those are the two avenues. If we're found that someone's not complying, like I said, it's dealt with just as any other performance issue would be dealt with. We have a progressive discipline policy that we would follow, and we would proceed accordingly. Again, for those that are not willing for whatever reason to comply with the policy on universal masking.
Thank you, Matthew.
I would I would also like to say on that point too, that out of mutual respect as well, I think it's incumbent upon everyone to be able to speak to someone personally as well. If they see them non-compliant, to respectfully let them know that that's the case. It's our policy to have the masks on, and to request that they place one on if they don't have one on, or to instruct them as to how to appropriately place it as well. That way it self-corrects internally without having to go through the hotline process. And certainly if you're intimidated by someone and you don't feel comfortable doing that, you can report it to the hotline. But I'd like to be able to have a culture where a medical student or anyone can come to me and say, hey, listen, you're not using this appropriately. And it's a way for everyone to be able to show that they're all invested with a common goal to keep us all healthy in the context of taking care of the patients we serve.
Great. Thank you, Dr. Homan. For Dr. Combs and Dr. Flenner, Scott Burns says, I'm a first-year PA student. Our class has been taking exams on our home computers since March. I'm happy that safety measures have been put in place at the testing center, but why take a risk at all if there's an equivalent zero-risk option, i.e. staying home? Has video proctoring been considered?
Again, there's a balancing act, and it is simply more secure to use our testing center when we can. And so we're beginning to do that. But again, we're taking steps to ensure the safety of that testing center.
Okay. Thank you, Dr. Combs. For Dr. Baumgarten. Oh, sorry, Dr. Baumgarten.
Yeah, just to add, Vincent, that there are some exams where remote proctoring is not an option based upon the organization administering those exams. So.
Great, thank you. For Dr. Baumgarten, Anonymous asks, is it possible that children are less affected because they've been out of school and not congregating with others? Once they go back, is it likely the number of cases will increase for children?
Good question. I don't think that I can answer this question. A lot of things possible, and we learn about this virus as we go. All we know that younger kids seem to have less disease and they transmit less, but older you get, the more risk you have. An ideal case scenario, and that would be my opinion, to start with younger kids and see how it goes. And if we're able to maintain a low transmission rate, then advanced it to a middle school and high school. But this is my personal opinion, and this is not any societal professional society recommendation. But again, I don't have an answer. So all we know at this point that kids are less affected by disease, and younger kids are not transmitting it to adults as much as we thought in the beginning of it.
Thanks so much for sharing your thoughts on that. For Dr. Stouter and Dr. Homan, an anonymous clinical staff member asks, has there been any discussion of hazard pay or other incentives for clinical staff who are not able to work remotely and are working directly with patients daily? Dr. Stouter?
There has not been any proposals for hazard pay. We have gone through a very tough year. We did apply for some federal assistance for our revenue impact because of COVID, and unfortunately we did not qualify. We have been really busy working hard trying to maintain our efficacy, our stability, and maintain jobs with minimal impact. So at this point, we have not entertained hazard pay. We really have been looking at how do we keep our medical group sustainable without the federal assistance that others have been afforded.
Thank you, sir. This next question is for Dr. Homan and Mr. Shang. Will employees be able to use the Family First Coronavirus Response Act with HR approval if their supervisor does not allow remote work while schools are virtual only?
So there's a couple things to point out with that. The clinical employees are exempt from that, from those regulations, so they're not covered. So while any employee is entitled to apply for the FMLA, most likely the outcome would be if you're a clinical employee, it's going to be denied. So if there's an extenuating circumstance, we do have an appeals process in place where employees could appeal that decision. But that when working on the clinical side, that's not an option in general. As with anything like this, I'd say it's always comes down to a case-by-case situation, so I can't answer for a specific person. I can only speak in generalities. Other employees may be eligible for it. So again, you'd have to apply, and a determination would have to be made. Every one of these requests is made on a determination is made on a case-by-case basis. So again, without knowing the specific details of the person asking the question, I can't give any more definite answer than what I've said here.
Thank you very much. I missed a question earlier, my apologies. An employee asks, Virginia is part of a coalition of 7 states that will purchase 500,000 rapid tests per state. Would EVMS receive any of those tests? Also, how accurate is the new antigen test? Dr. Baumgarten and or Dr. Stouter, perhaps?
I will share information I know. So rapid antigen tests historically have been less accurate than PCR tests, which we do right now. So sensitivity of PCR testing is about 75 to 80% with the testing platforms we have locally. It varies depending on the specific and their sample obtained. I do not believe that we are going to be acquiring any of those 7 rapid tests that are going to a community. I think that other health organizations and urgent care centers will be acquiring some of the tests. I know that Velocity will be obtaining a rapid antigen test and one of their, local resources for us. And now antigen tests also in their 3rd generation. So it might be that they are also, not might be, we do know that they are also getting better in terms of sensitivity and specificity, and 3rd generation tests are better than early generation. So hopefully, very soon we'll see similar sensitivity and specificity for antigen tests, but I don't think it's there yet. So quick answer, we're not getting those tests. Some of our community partners are getting those rapid tests. Overall sensitivity and specificity are lower for antigen testing than it is for PCR testing. Gold standard still PCR at that point.
Okay, thank you, Dr. Baumgarten.
Although we're not able to get the rapid testing at the moment, we are looking at trying to reduce the turnaround time from what has been 7 days to 4 days. We're working with ODU, who was given a grant to set up a testing site, and it's here in the building that the medical group occupies. So Dr. Baumgarten and I are going to meet with them and see if we can partner with them, create more capacity to get the turnaround more within like a 24-hour period. So it's not the rapid test, but we are seeking ways to get a more responsive test result.
Okay, thank you very much. This was directed to Dr. Baumgarten, but Dr. Combs may also have some insight on this. Howard White asks, is there any information site concerning where there will be larger concentrations of students or any other groups on campus to enable such concentrations to be avoided?
There is no site for that. We don't envision large groups of students being on campus at all, but when they are, they're going to be in one of the lecture halls. Again, to maintain social distancing, just to give you an example, McCombs Lecture Hall holds about 350 people. With social distancing and dividers, we can get about 70 people in there. Roper, similar, go down from 150 to about 30 seats. But students, that's something we can consider as to whether there are opportunities in the academic schedule to let folks know when they're going to be a large group of students. What I can tell you is the location will be in the lecture halls, and when Waitzer Hall comes open, that's the purpose of the podium, so that we've got 3 levels there. But we can think about how we might be able to get a schedule out. Again, it's a fairly infrequent event, but that's a reasonable question, I think.
Great, thank you. Dr. Baumgarten, same person asked, Are there long-term plans for continued testing to identify infected individuals?
Great question. So we continue to test, and yes, we just moved into a more permanent building. We continue to use LabCorp for the time being, and because of their increased number of cases, we, as Dr. Stouder mentioned, we have seen significant delay in testing return, and it also was nationwide shortage of reagent. And right now, things seem to be improving and moving in the right direction. So our testing time right now down to 2 days, and we're exploring other options, as Dr. Stouder mentioned, meeting with ODU tomorrow. More to come, but fundamentally, yes, we continue to provide testing. We think that it's very important, and we are glad that we're able to provide it, because with number of cases in the community, as you may know, it became nearly impossible to get tested through CVS or Velocity because of the long waits, number of hours, 4 hours, and even further delay with testing, because we are a healthcare organization primarily focusing on employees. We're able to achieve agreement with LabCorp where they are prioritizing swabs obtained in our testing site. So yes, we plan to continue. Very important to give real-time information, and ultimately this is our way of taking care of our EVMS community, where they know that they could get screening information, they could get testing information. Testing in our site also comes with number of educational material, handouts, self-monitoring forms, so it's a lot more than just testing itself. And more importantly, we have access to results where we can obtain them in a timely fashion, share it with occupational health, which ultimately alleviates a lot of anxiety among people who are being tested because it's stressful, but also helps administratively with the process, because it allows for process to go more smoothly, where we know what each party is responsible for, and we communicate with our employees in real life, in real time. So again, if you've been through drive-through, you've seen Allison and me, and you will continue to see people in our drive-through testing center.
Great, thank you very much. For Dr. Combs, Anonymous asks, several universities in Virginia require that students be tested for COVID before coming back to campus. Does EVMS have the same plan?
Short answer is no. We do require all students to complete a screening survey. And I know a number of universities are going to do that. Between CDC guidelines and the advice of our infectious disease physicians, the point continues to be made that when you give someone a test, that test is good for the time at which you give them the test. The situation could change in an hour, in a day, in a week, and access to testing and timely results is problematic. So that what we've developed is a screening tool that says if you feel sick, stay home. If you're at work and you feel sick, go home. Take the screening survey, which asks symptoms, and we'll follow that up either through student health or occupational health, depending on whether you're a student or an employee, and that approach seems to be the most effective. It's you also go to a lot of places that take temperature, and the science behind that is that really is a placebo, because temperature varies. Number one, the notion of a temperature at 98.6 is a norm. There are variations around that every day. And the problem is you go in, somebody takes your temperature. In and of itself, that's simply not a predictor of COVID. And so what we're trying to do is to be as practical as possible, follow the literature about diagnosis, and emphasize the masking and social distance as preventive. I don't know, Margaret or Ron, if either of you want to add anything to that.
This is Margaret. I will just add a couple of comments. I think you are absolutely right, and number of our regional healthcare organizations initially were testing their personnel, or personnel in particular, and then finally gave up on this because testing is only good for a day you were tested. And if you're negative, in order for you, and we still do some pre-procedure testing. And if it's not rapid test, that all those people asked to be quarantined. So it's not just test that, answers your question. So it gives you reassurance for the day you received it. But even for the day you receive it, again, it will give you reassurance for a future. We get a lot of questions in our drive-through. I was in contact with someone yesterday. Should I be tested now? Well, unfortunately, we can test you, but the reality is we're probably not going to detect PCR in your secretions just because disease has its own course. And, in order for us to do it, certain number of days has to pass from their exposure to when we could detect it. And, Virginia Department of Health Infectious Disease Society feel that it might be 5 or 7 days, but the recommendations are if you were exposed, and if your test is negative, and we're at Evms test on day 10, according to our protocol when testing is available, we still want you, especially if testing done day 5 or 7, we still want you to be out for 14 days because it still doesn't give you complete reassurance. And I already mentioned limitation and sensitivity. In 75-80%, we're looking about 20 to 25% of falsely negative cases. So it's not an absolute, and again, we feel it might be just false reassurance. It's important to have testing available. It's important to test all people who been experiencing symptoms and a certain type of contacts. But again, global testing, I don't think it will answer our questions right now. And testing technology may change, our knowledge may change, maybe more will come in the future, but this is where our position is for right now.
Thank you very much. Dr. Flenner, Anonymous asks, for students entering the wards, what PPE will we receive besides the Cupron face masks? Will we receive some sort of eyewear and face shields?
Yes, actually, Dr. Hooper has informed the students of the PPE they will receive, and many of them who are in the 4th year and completing electives have already picked up that, which includes N95 mask as well as a face shield and surgical mask as well. And just to make the point that the Cupron mask is not indicated for clinical exposures or in the clinical arena. So we provide appropriate face masks for that situation as well as N95s and a face shield.
Thank you very much. For Dr. Baumgarten, an employee asks, how will COVID screenings change once flu season begins since the symptoms are so similar?
Good question. So we're having a meeting to discuss this particular issue. In some countries, what they see when COVID appeared, flu cases disappeared. So we don't know what will happen at the landscape of different viruses, coexistence of different viruses. We are discussing the option of testing people for flu and COVID at the same time. More to come. More to come.
Okay, thank you very much. For Helen Hesalius, an employee asks, while it's appreciated that EVMS is supplying the Cupron masks, they seem to not fit well in general. Is it possible for EVMS to explore another vendor for a similar mask that may fit better, particularly for those that use eyewear?
Yes, we can certainly look into that as we go to order more masks. I do believe we already have an inventory of the Cupron mask, but as we go to look at new inventory, that will be something that we can take into consideration.
Great, thank you very much. This one is for Mr. Shang and Dr. Homan. There are two kind of related comments here. Employees keep asking about remote work because some supervisors think COVID is not a threat and want employees back no matter what. We're looking for a firm directive from administration that if your job can be done remotely, it should be. Less supervisor direction. Is that possible? And then a second one on that. Anonymous says, I agree with those requesting a work from home directive for administration for administrative staff. My department has a director that made us all come back June 1 so that he could tell sponsors our entire group was back on campus. Obviously, there's a lot of concern about this. And Mr. Schenk, I'll turn it over to you first.
Sure. So again, it's difficult for me to give a specific answer because when the comment is made that we should direct supervisors that if a job can be done remotely, that they, grant remote work. But part of the process is determining if, in fact, that job can be done remotely. I understand employees may feel that it can, and they are certainly, everyone is entitled to their opinion, but that's where the interaction has to occur. We have to have a discussion because there could be reasons that they're not thinking about, concerns the supervisor has that they feel need to be addressed by having the people come back on campus. It's really difficult for me to wade into that on a forum like this without knowing what the job is, what department they're in, who the supervisor is. This is really something that, again, you can't give a blanket directive and say just because you're in an admin position, you should never have to come on campus. You should be able to do everything from home. It's not that simple, unfortunately. I wish it was. It'd be easier for everyone, but it's not. So if they've had a conversation with their supervisor and they are not happy with that outcome, or they feel that there's some other issue going on or reason that they can't work from home, I would strongly encourage them to come and talk to HR. There are a number of people in my office that can work on these types of issues, but you can always contact me directly, and either I will respond, or I will make sure somebody responds to you and works with you as best we can. That's about all I can say without more information.
Thank you, Mr. Shank. Much appreciated. For Helen Hazalius, RD asks, how are our shuttle buses being cleaned since anyone can ride on?
The shuttle buses are being cleaned by the driver at every shift change. So they are being cleaned. They're being cleaned by the drivers.
Okay, thank you very much. For Dr. Combs and Dr. Flenner, Anonymous asks, been seeing on the news where multiple other institutions have students, residents, and fellows attending parties without masking on their own time, with large outbreaks of COVID-19 associated and sometimes impairing a department's functioning. What are we doing at EVMS to avoid this happening here?
Well, we're trying to do everything that we can to educate people that what they do off campus affects what they do on campus in terms of their health. The example that you cited is a real one. I'll give you a specific example that happened here at EVMS, which is very concerning. We had a resident who wasn't feeling well, came into work. The attending sent the resident home. Resident felt a little better, went to a barbecue, interacted with about 25 people, felt a little better, came back into work, started feeling bad. A second attending sent the resident back home, who then began to feel a little better and went to a wedding with 75 people, and finally ended up reporting to the health center and getting tested and proving COVID positive, which then triggered the contact tracing, that the individual was in touch with about 100 different people, and 25 of them met the criteria for close contact and had to be put into quarantine. So that one individual's behavior had about 5 different points that a different decision could have been made, but instead the wrong decision was made. And so 25 people lost 2 weeks of work. That's equivalent to 1 FTE physician. That's a whole year that we lost because of that behavior. So we're very much aware of it. We're doing everything we can to communicate to faculty, staff, and students that fighting COVID, unfortunately, is a 24/7, 7 days a week activity, and you can't draw an artificial line. We will continue to get that message out in every forum that we can, and we ask for your help in helping people understand this is real and the consequences are real. Ron, I don't know if you want to add anything.
Really not much to add, Dr. Combs. This is a discussion we have regularly with the ramp-up committee, with the involvement of Linda Archer from Graduate GME as well, just for educating the residents the implications of irresponsible behavior outside of work.
Thank you both. George asks, EVMS is appropriately strict when requiring masks on campus, and thank you for that. Why does that not apply to construction workers and waits, or many do not wear masks at all? Helen Hazalius?
Yes, the workers at weight stores are required to wear masks as well. We did bring this up with Ballard at the end of June, and Ballard has a monitoring criteria. There are certain circumstances when the workers will not be wearing masks, and that includes when they're on the man lifts. They will not be wearing masks, and when you see them up on the lifts, they due to their safety, they will not be wearing until they return to the ground. As well as during their breaks, they are allowed to not wear masks. So if this is something that you're witnessing, I'll take just confirm with Ballard and make sure that they're continuing their monitoring. But the directive to them is the same as for all of our employees at EVMS.
And a follow-up question for Mrs. Alias. A staff member asks, are staff able to still request masks provided by EVMS? If so, how?
Yes, the process for requesting masks is done through your department. So if you can just reach out to your department head and find out and coordinate with them, and then they can contact materials management to request the additional masks that are needed.
Okay, thank you very much. I believe this one's for Dr. Baumgarten. Anonymous asks, is it truly safe to wear a face mask all day? How do we verify that these are being worn by everyone in the building and parking garages?
Great question. So COVID pushed our limits, and if you recall, a year ago, N95 and everything else has been designed for single use. So what we're doing right now is extended use of a mask, and presumption is that when you're using, say, a mask, you do not touch any surface that is facing the front of you with your hands. So if you need to take it off, then you're doing it carefully using loops. But in an ideal world, you want to maintain your face mask for as long as you could. And again, their key is not to touch fronted with your hands, and there are instructions for how to take off and put on mask in our PPE policy, which means you have to clean your hands before you touch it. You only use ear loop piece, and you wash your hands after all. If your mask is contaminated, if you feel that somebody sneezed or coughed on your mask, if your mask has makeup or other kind of, materials on it that it is not appropriate to use anymore, so it has to be replaced, and you need to use a new one. However, recommendations are daily use are endorsed by all local healthcare organizations that we partner with, Centera, Bonsecours, HKD, and EVMS. And that's recommended extended use by healthcare organizations.
Great. I have a follow-up question for you, Dr. Baumgarten. Anonymous asks, advice for staff with allergies that are daily playing the is it COVID or is it allergies game. Some of us feel like we can never come back to campus because we have chronic allergies and thus symptoms. Your thoughts and suggestions on this?
Good question. So I think that when we're screening you for COVID, there are a few things. We're looking for the new onset of symptoms, something that you didn't have before. And if your allergies are that bad that you cannot, cough or wear a mask, then you need to see your allergist or your doctor and make sure your symptoms are taken care of, that you're able to tolerate mask. And this question always in the back of your mind, and it's very true, and it helps you walk through. If I'm feeling today, same I felt yesterday, and I've been feeling like this for 2 months, and it always happens to be at this time of the year, it's probably allergy. But again, you can always consult with your private physician, with your primary care physician, and get some answers. But typically when we see COVID and cases that we saw, people had new onset of symptoms, something that they haven't had before, something that felt different to them. If you experience new symptoms, please report to occupational health. If it's the same type of symptoms you're having, because you're right, nothing happened to allergies. If somebody had allergies for 10 years, for 15 years, or whatever years they had, they're going to have allergies, and COVID is not going to do anything. But again, look, your body well, consult with your primary care physician. That's the best advice I can give you.
Thank you, Dr. Baumgarten. Dr. Combs, this one's for you. A staff member asks, given the non-compliance or lack of wearing masks correctly, is there consideration for more on-campus infographics, et cetera, about correctly wearing a mask or more interactive training within departments?
Yes, we're continuing to add signage to address all aspects of it. It is an ongoing communication problem, and we're trying to push information out continually and in new and different ways.
Okay, thank you very much. Someone was seeking advice from Mr. Shang. An employee says, masks are not being worn by some staff members in my workspace. I haven't reached out to HR as I'm afraid there will be no findings, leading to more frustration. What should I do? I suspect your answer is you still need to report it to HR and let the process work, but Mr. Shang, I'll turn it over to you.
Yeah, I mean, I can't forecast what the outcome of the investigation would be until we investigated. So it would be, my answer would be exactly as Dr. Rhodes said. We still need to report it and we need to look into it. Or if as Dr. Homan said, if you feel comfortable, you could ask that they put the mask on. But again, if you don't feel comfortable in that situation, we certainly don't want you to do that. So those are really your two options: address it directly or come to Human Resources and let us try to look into it and see what we can do.
Great. Okay, thank you. An anonymous participant observes, I've noticed that classrooms and venues are not being cleaned after use. What are we doing to deep clean those rooms? Mrs. Alias?
The classrooms are to be cleaned up, on a daily basis. So the deep clean would be occurring after hours.
Okay, thank you very much. This is for Dr. Baumgarten and perhaps Dr. Combs as well. An employee asks, isn't it a risk allowing possibly asymptomatic students who are not tested enter offices on campus for assistance when they could expose those employees?
This is a great question, and it's very hard to identify asymptomatic people without any exposure unless you do population of health type of screening. So, I mean, the risk exists. There is no question about it. Have we found those cases around campus? No. But if you have an exposure to COVID positive case, then again, you need to contact and you need to go in quarantine. I also wanted to mention about this positive PCR overall PCR test doesn't tell you that you are currently infectious or it's a live virus. So there are some complexity to that issue overall. So my advice, if you've been in contact with someone who you think is positive, quarantine for symptoms. And CDC no longer recommends testing before people return to work after having COVID, and that for that very reason, PCR could stay positive for a very long time, even to someone non-infectious. CDC recommendation 10 days from the beginning of the symptoms, presuming somebody doesn't have fever or has improvement in system. And this is data supported because studies show that after about 8 days of illness, if somebody is having mild to moderate disease, not immunocompromised, researchers could not grow virus, so viral cultures from secretions were negative. So there is always risk, just like there is risk of all of us going to grocery store and with community being exposed. The best solution we have for that is use meticulous hand hygiene, wash your hands, wear a mask, because ultimately this is how we are acquiring virus exposure to mucosal membranes. And our policy at Evms really endorsing this concept. If both of us are wearing masks, it becomes irrelevant if one of us gets sick or as symptomatic or asymptomatic positive, because now we followed all strategies that we know reduce transmission. So universal masking, and again, remember that most of their exposures in our clinics, as Mr. Stauder pointed out, even when we quarantine people for exposure in a clinic to patient or employee, we had 0 positive results. and 29 employees, majority of them could not identify any contact, and they were not working in COVID ICU or taking care of COVID patients, but they did acquire disease. So when you're in a community, we expect you are using your app because you are concerned, because you are a good citizen, because you're who cares about yourself and cares about others. So the best strategy we have to reduce transmission either from symptomatic or from asymptomatic people.
Great. Dr. Combs, did you have anything to add?
No, just to reiterate, we can't make risk go to zero, but if you're wearing a mask and you're requiring students to wear a mask and you're at least 6 feet away, the science is overwhelmingly clear that your risk is about as low as it can possibly get. So I would say don't meet with students unless those conditions are met. That's our policy. And if you do that, that's as much safety as we can provide.
Okay, thank you very much. Dr. Baumgarten, this question's for you. Is it true that once we're out of social distancing and have been using masks all this time, that our immune systems will be weakened and the virus won't ever go away until we're all exposed? Is that correct?
Well, I don't think it's necessarily the case. I think that you might be referring to herd immunity, where for disease to go away in a society, certain number of people need to have disease. But there are other successful ways of making virus go away because we're the reservoir. We're the ones who are sharing it with each other. So we're the ones who are direct contact. So it's up to us, and by utilizing social distancing, we can reduce and we can flatten the curve, because ultimately it becomes about one person in others. So if we could eliminate number of contacts and we can eliminate number of exposures, we can make this virus go away. But it will require an effort from all of us. And while we couldn't make it go away, because we couldn't do it well yet, and there are some states that are more successful than some others, and I think Virginia is a good example of how we saw increased number of cases clearly correlating with phase 3 opening. And that is just example that what happens when people start gathering together, then instead of one person infecting, less than one person, it becomes 1-to-1 or whatever that number is. So we can do it, and there are countries that have done it successfully, but it will require us to wear a mask, and it should not and will not make your immune system.
Got it. One more question here. We are coming up on our time. We've got about 2 minutes left. We're going to hit 2 more questions, and then the others we'll have to post answers to. Dr. Baumgarten, someone gave a variety of stats. To date, there are 4,802,491 positive cases in the U.S. That's 1.45% of our population that's been affected, and 175,631 deaths in the U.S. The deaths equate to 0.053% of the U.S. population. That's 0.5% or so. These numbers are based on CDC counts as of this morning. Why are we quarantining and social distancing? The flu is more contagious than COVID-19 is. H1N1 was more contagious than this seems to be. Your response?
Well, my response is that, I don't want to get into political debates or just statistics. If you go on Johns Hopkins website, all those numbers. And those numbers are skewed, a little bit skewed number when you're talking about death rate, because now you're having large population, healthy and not healthy one, and mortality is there, and mortality people admitted to intensive care unit is extremely high. So, and it's true that majority of the people have severe disease, but those who do often die from it. And that is of concern, and we as a society need to respect that. And using universal masking in several European countries, again, changed their outcome And quarantining is very important because we have number of people, vulnerable people in our society, those who are older, those who have comorbidities, and those who are immunocompromised. And those are the ones who will develop severe disease. And those are the ones who are at risk of dying. And I don't think there is anything or any statistics that will replace or change someone's opinion about one individual life. And I will get back with another statistic. So our positive rate in Norfolk is 12%. And when we had Patient Safety and Quality Committee in United States, we had 1,050 cases. So on March 11th, we had 1,050 cases. Fast forward 5 months, we have almost 5 million cases. So this is really astonishing statistics, and that's disease that we didn't know about before, that disease that doesn't behave like a lot of other diseases behaved, and our vulnerable population continues to be at risk. So we as society, in my opinion, should do everything what we can, protect each other and protect vulnerable ones. And we're relying on evidence, and that's what's driving our policies. So we are about facts and not myths. I hope I answered your question.
Thank you very much. This last one is for Dr. Combs before we wrap up. An employee asks, ODU sends daily COVID check-ins via email, asking people to check their symptoms, updating information, etc. It can be a little bit annoying, but honestly, I think it's a good idea. Could EVMS do something like this?
We can certainly talk about that in the task force. Again, our emphasis is trying to do things that actually have an effect as opposed to being seen to do something. And I think our approach about requiring screening when there's symptoms and requiring people who feel ill to go home or to not come in are proven to be effective, but we can have a discussion about that. We in general as a task force have been prone, as you can tell in our discussion today, to look at things as practically as we can and not do things like temperature checks or testing that we think just don't have a beneficial impact. They may look good, they may look like you're doing something, but they don't have an impact. We're trying to look for things that have an impact, but we will discuss it.
Okay, thank you very much. I'm going to give one comment to our panelists. Anonymous said, thank you, Dr. Baumgarten, for your direct remarks, and to all of you on the panel who are giving us open and honest communication. Thank you, everyone, for making time today. We had about 340 people online. As a quick reminder, don't forget, faculty and staff awards are going to be held, although not as an in-person celebration, and that nominations are due August 28th. You can find the nomination form online at evms.edu/awards. Again, thanks to all our panelists, and before we conclude, I would like to turn it over to Dr. Homan for any closing remarks. Dr. Homan?
Thanks, Dr. Rhodes. I want to thank the panelists. This has been a great discussion, very probing questions. I want to reassure the faculty, staff, and students that we're making our decisions based on evidence, by national evidence, our experts in infectious disease, and we're doing the best that we can. Recognize that this is in the software mode, essentially, where there's version 1.0, and then it becomes 1.1.2. We refine this as we go along. It's going to change. So don't be surprised. As the data becomes available, we make adjustments. And as well, I want to make sure that we can do the best we can for remote work for our employees, and work with your supervisor. And if that does not come to a resolution, speak to human resources. And then continue to be able to provide information to everyone to keep us all safe on the campus, off the campus, and allow us to be able to improve the health of this region by having the clinicians and workforce healthy, so we can anticipate more of a possible surge later this year in the fall. So I want to thank you all for your diligence, your courage, your work, and for all that you've done for EVMS. And we're going to continue doing this every other week or so until we have an indication from you all that it's not worthwhile. But I do think it's worthwhile, and the communication is very helpful. The questions that weren't answered will be posted on the web. So please be safe, and thank you for all you do for EVMS.
Thanks so much, everyone. This concludes our town hall meeting. As usual, we'll be scheduling another one in about 2 to 3 weeks, so please pay attention to your emails for that date. And with that, we'll conclude. Thank you, everyone.
Yeah.